I want to talk about genetics and how you can benefit your body and improve your health by utilizing your genetics. I'm Dr. Philip Boob, a functional medicine doctor here in Austin, and I'm going to tell you more about genetics. So you might not be too surprised to know that your eyes are blue or brown because of your genes, but one thing you probably haven't been told is that your genes are not your destiny. You can manipulate and change your genes. We call this epigenetics. And the idea is that you have certain genes that are used every day on and off, but you can turn those genes off by doing certain things, and you can turn those genes, other genes, on by doing other things. And so let's say you're gaining weight. One of the reasons you're gaining weight is maybe you're eating too much sugar, you're turning on your insulin production, and you're turning on your ApoE4 gene, and that's causing more inflammation. And as we know, inflammation leads to more weight gain. And so you need to be testing your genetics so you know what type of foods to be eating, how to eat, what are some of the things you're at risk for. And maybe it shouldn't change necessarily everything you eat, but it gives you that extra little motivation like, wow, I'm at risk for Alzheimer's. I should probably get my act together because I've seen someone with Alzheimer's and that's not how I want to end up being. So now I'm really going to straighten up. So we unlocked the human genome in the year 2000, which means we coded the whole thing and we thought we were just going to have the world at our fingertips after we knew what every gene coded for. Well, it turns out that wasn't exactly true because it's now 2016 and we really haven't made a lot of progress, almost 2017. But functional medicine has brought to the forefront using genetics and using epigenetics to actually motivate and move your genes into the right direction. So there's a lot of genes we can test for. I don't want to say I do every gene possible, but I do want to say I look at very important clinical genes that we can use and that we can manipulate, so to speak, or turn off or turn on certain ones. If you have a certain gene problem, it also might mean that you need to take another supplement or basically kind of a workaround for that genetic mutation. If we can't do it with food and exercise, then that might just mean you need to take an extra supplement. So let's go through a few mutations that I test for regularly and look at. So I was inspired to do this talk by a patient who apparently I went a little bit over her head when I was talking about genetics, and so she wanted me to record this video so that she could watch it and go over it. And so this is her report. It doesn't have her information on it or whatnot. But here's just a few things, and so I realize this is going to be a little backwards, but let's just go over a few things and I'll make notes in the comments. So apolipoprotein E, that is one of the most common genetic SNPs that I test for and see. And basically what it means is this is your high cholesterol risk marker, this is your high inflammatory risk marker, and this is your Alzheimer's gene. Now there's tons of reasons to develop Alzheimer's and we're still kind of figuring it out, but this one is definitely associated with Alzheimer's. So if you've got a 4, so there's 3 different possibilities, 2, 3, and 4. The 3 is considered the normal one. So if you got a copy from mom, a 3, and a 3 from dad, then you're perfectly fine as far as this risk is considered, and you're at lower risk for Alzheimer's and inflammation. However, if you get 1 copy of a 4, then you're automatically in a higher tier risk of inflammation and Alzheimer's. If you get 2 copies of a 4, man, you've got to be on the straight and narrow all your life because your risk is just extremely multiplied. We talked about turning on genes and turning off genes. Well, when you've only got 2 bad copies, you can't really turn one of them off that well. Or I should say, if you turn the other one on, well, it's also bad. And so those people really have to eat a great Mediterranean high omega-3 diet, low in carbs and bread and stuff. And so the other gene or the other mutation that go along with that is a 2. So 3 is normal, 4 is really bad. A 2 is considered the in-between. It raises your risk, but not as significantly as a 4. So this person has a combo of a 2 and a 4. So because they've got a 4, they're at increased risk, and they can't really rely on their other gene because that one's mutated also because it's a 2. And so this person is at high risk for inflammation, and of course they're actually struggling from inflammation, and that was one of the reasons I was seeing them. So basically what we advised her to do, what I advised her to do, was to eat a Mediterranean style diet, higher in omega-3s, and she's really got to watch out for the carbs. The other genes we test for, and this is what I consider my basic lab panel, although it's 9 pages of basic labs. The other genes I commonly test all of my patients for is the factor V Leiden and the prothrombin mutation. Those are blood clotting disorders, and it's good to know whether you're at risk for that increased blood clot. It can cause blood clots in the heart, strokes and things. It's not that common, but every now and then I catch someone. I had one of the mutations, and so for long plane flights and stuff, it's important to take an aspirin. But the most critical thing, the celebrity gene, is going to be your MTHFR mutation. So this person had 2 copies of the MTHFR mutation, and there's loads I can talk about with MTHFR. The MTHFR has become the celebrity gene. If you know any one gene mutation in the entire human genome, it's most likely going to be the MTHFR. It got so much publicity. I'm not really fully sure why. I do believe that methylation is important, but when MTHFR got discovered, man, people took off with it. There's whole websites dedicated to this one gene problem. In my opinion, your problems are all not from one gene. This is an important one, and it matters, and I always treat it whenever I see it, but it's not the only thing that's going on with you. At least that's not my belief. So what is MTHFR? Tons of stuff out there. Be careful what you read. Don't get lost in what you read, and don't believe everything you read. And so what the research and what is really proven now is that the MTHFR gene, it codes for the translation of folic acid, or folate, which is in your diet. It's found in fruits and vegetables. Basically, any organic material has folate or folic acid. That MTHFR gene, or enzyme, converts folic acid into the active form called methylfolate. And that's all the gene stands for, MTHFR, methylene tetrahydrofolate reductase. And so it activates that folate molecule. And so to the body, folic acid and folate is fairly useless. It has to be activated into the methylfolate. So if you don't have that enzyme, or I should say everyone's got this enzyme, otherwise you were not born, you were miscarried, you were dead. And so if your enzyme is dysfunctional and not as good as it needs to be, then you can actually struggle with inflammation. And the main reason why is because that methylation cycle, that methylating the folic acid, actually provides antioxidants and anti-inflammatory molecules to your body. So if you have a really bad MTHFR mutation, like I do, then that means you aren't methylating very well and you can't create enough glutathione and other antioxidants to properly detoxify the body. So if you're eating a poor diet and not exercising and stressed to the max, then your homocysteine levels are going to be high. And it is a medical fact, I learned this in medical school, that elevated homocysteine levels lead to early strokes and heart attacks. What I wasn't taught in medical school is why, and I think the conventional medical field didn't really know why. High homocysteine just means you're having early heart attacks and strokes. Well, I had high homocysteine when I first started doing my labs, and I want to tell you that it was really easy to bring down the homocysteine level. Basically, you get on B vitamins, a B complex vitamin, but you need the methylated folic acid if you have an MTHFR mutation. Because once you have that enzyme, you need to go around that folic acid blockade into the methylfolate. So you can't really support that reaction at all, but instead you can just take methylfolate, your body will readily absorb it and put it to use, basically. So if you have a high homocysteine, or if you've never had it checked, please check it. If your homocysteine is high, just start a B complex every day, but make sure when you're reading the supplement bottle that when it says folate, that in parentheses it says L5-methyl tetrahydrofolate or 5-MTHF. There's several different ways. There's a couple I don't really like, the 6S version, but anyway, that's getting a little nitpicky. So just getting on a B complex really helps that MTHFR mutation. The problem with the MTHFR mutation is that people got stuck in MTHFR and didn't look at the rest of the cycle. The whole methylation cycle matters, and there's multiple mutations that go along in it. And if you only focus on the MTHFR, then you're kind of missing things. So I've got this on my iPad, and I'll try to edit the video so you can see it better because it doesn't come out very well. But that's the methylation pathway, or the methylation cycle. And as this is a real person, as you can see, this person has multiple mutations, and the one that they really don't struggle with that bad is their MTHFR mutation. But the other mutations, the TCN2, FUT2, and MTR and MTRR, Those are all B12 enzymes. Those are utilized in taking B12 from food, converting it into the actual B12, absorbing it into your system, and then once you have it in your system, you actually have to get it into a cell, because just B12 floating in the bloodstream doesn't really do a whole lot. The B12 has to get inside of a cell in order for it to work. So there's multiple mutations that can happen there. Then once the B12 is inside the cell, once it's used, it can be regenerated. And so one B12 molecule can basically be used multiple times before it's discarded. Well, if you have these MTR and MTRR mutations, then that means your B12 is kind of one and done. It's not adequately regenerated. And so there's multiple errors to have B12 problems along the way. And based on where your mutations are is where I'm going to recommend what type of B12 you need to be doing. Many people can get away with just taking more oral B12. That can raise the serum or blood concentration of the B12, and just raising the concentration sometimes forces it into the cells and gets it to work and really do what you need it to do. But that's another reason to have high homocysteine levels. There's a lot of people right now pushing methyl B12 because of the MTHFR issue, saying that if you have MTHFR, you need all methylated B vitamins. That is not true. You can over-methylate. Look it up if you don't believe me. Over-methylation is not fun. It triggers anxiety and just kind of creepy crawlies in the skin, not feeling good, not sleeping well. So over-methylation is a real thing. I don't see it so much with over-methylation of the folic acid vitamin, but certainly I've seen it with methyl B12 many times, taking too much methyl B12. So I prefer to take hydroxy or adenosyl B12 because that doesn't force the cycle into over-methylation. If your body doesn't need it, it just urinates it out, no big deal. If you take methyl B12, that's adding real methyl groups to the system that it can't always deal with, especially if you have other mutations. So depending on which mutations you have in your B12 genetics, we might be actually prescribing shots of B12 because you just can't get it into the cells, you can't get it into your system high enough, or maybe you've just got gut dysfunction. You need stomach acid in order to break off B12 from food and then be able to absorb it. You need something called intrinsic factor in your saliva and stomach in order to be able to capture that B12 and absorb it into your intestinal tract. And then if you have any kind of intestinal inflammation or malabsorption, you may not be absorbing the B12 there either. And so many times we'll use shots just because that's foolproof. Once you shoot yourself with B12, it's in the system. Now we just get to kind of dial the dose and how often. So B12 is a common problem I see overlooked instead of just forcing the folate cycle. The next enzyme that seems to be stealing the spotlight lately for me is called the COMT enzyme. This enzyme is kind of at a critical point in the pathway of the methylation cycle. It's at so-called the end. Although the cycles are literally cycles, there's not really a start and finish, although we like to kind of talk about it like that way. Those cycles are constantly creating cofactors and things that are being generated. It's not just a here to there kind of thing. So the COMT mutation basically demethylates this whole cycle. So we spent a lot of effort methylating the cycle. This COMT now has to demethylate it. And that seems stupid. Why would the body methylate it only to demethylate it? But it's an incredibly complex biochemical pathway that I don't even want to act like I fully understand. But the COMT enzyme also breaks down your adrenaline molecules and your estrogen hormones. So people with this COMT mutation, they don't have a good methylation pathway. They're at higher risk of inflammation and all that because of their poor methylation pathway. And then because they have the COMT mutation, they're also at increased risk of panic attacks and anxiety, because if you can't properly break down your adrenaline molecules, your adrenaline hormones, then when you've got an adrenaline spike or an adrenaline push, guess what? It's going to last so much longer for you, and it's going to spike so much higher because you can't break it down that well. Moreover, if you're a female and you've got a mutation in that COMT enzyme, then you can't break down your estrogen adequately. So when you ovulate and your estrogen spikes to 300, which is normal, that estrogen curve is just going to last so much longer. You're more likely to get PCOS and estrogen dominant symptoms. I did a whole video on estrogen dominance. You should look it up if you're struggling, because I specifically talk about this COMT enzyme. And so if you have a mutation there, then it really makes multiple things go wrong. And so I see almost, I don't want to say everyone, but I mean, I feel like it's 90% of the patients that I see with anxiety, when we finally get their genetics, they almost always have a COMT mutation. So what do you do about it? We talked about methylfolate, we talked about B12, and now we're talking about COMT enzyme. So if you have the COMT enzyme mutation, my favorite product is called DIM Detox. Pure Encapsulations kind of designed that product for people with the COMT mutation. So it's really got kind of everything in it you need to properly enhance that COMT enzyme. And so that supplement has DIM, which helps you encourage that COMT enzyme. Plus the DIM helps you break down the estrogen molecules. Then it's got calcium D-glucarate, which prevents the estrogen molecules from being reactivated into the system. So there's multiple things in DIM Detox. Depending on what type of mutation you have or how severe it is, I'll change the dose based on where you're at. So the COMT mutation is pretty critical. The next mutation is the CBS mutation, and I'm going to curb that one for now because there's actually another enzyme that seems to be mimicking that enzyme, and so we don't really want to react to it too much right now. But the other mutations that come along, or other genes that come along with this this 23andMe report or Pure Genomics report, are how well you absorb vitamin D and activate it, and then same thing with vitamin A, how well do you absorb it, activate it, and turn it into the active ingredient. And so for people that have those mutations, we're going to aim for higher vitamin D levels. So I'm normally aiming for 60 in all of my patients, kind of 80 in my osteoporosis, osteopenia women or men. So if you have a vitamin D mutation like that and you're younger, I'm not going to wait until you're osteopenic to say you need more vitamin D. I'm going to start increasing it to 80, maybe even 90 to get all that vitamin D into the cells, because that's a mutation that prevents the vitamin D from getting into the cells where it actually does stuff. When we're testing the vitamin level, we're actually just testing what's in the bloodstream. The final part of the Pure Genomics report, at least right now, and let me talk about this while I'm thinking about it, the way I encourage all my patients to get their genetics tested is through the 23andMe report. That's something you can get online by yourself, 23andme.com, 23andme.com. If you go to my practitioner referral link, you get $20 off. They don't give me anything, but it's 23andme.com/DROUBRE, so DROUBRE, and they'll give you $20 off, but then charge you $10 for shipping. So really, it's only $10 off. So feel free to go there. They'll process it a little faster if you go through me. Once you get your 23andMe report, then you're going to be submitting it to Pure Genomics, and that's a free website. They interpret it, make it clinically useful. They're not going to give you every gene mutation you possibly have. They're only going to give you the clinically relevant mutations, which is nice because so many reports just give you too much information. You just don't know what to do with it, and sometimes it's conflicting. The goal with Pure Genomics was that they only want to present enzymes that we know something to do, and that there's not going to be a conflicting enzyme that does the same thing. The great part about Pure Genomics is that it's an ongoing project. And so when they first started, they only had the methylation box. And now there's the vitamin D box, the vitamin A box, and now they've added a glutathione detoxification box. And so the reason I'm telling you that is because once you upload your data, it's there. Your genes aren't changing. And so if you periodically check your Pure Genomics every 6 months, 12 months, you might find out about new gene SNPs that you need to be watching for, taking supplements, addressing, whatnot, or talking to your doctor about. So with that being said, the last part of the Pure Genomics report that is useful is the detoxification and antioxidant profile. And so this addresses two key components in your detoxification. It talks about when you create energy in your mitochondria, these superoxides can be created as a free radical, a damaging process. I'm trying to make this simple. So anytime you create energy, this is how I kind of explain it. Anytime you create energy, it doesn't matter if you're an automobile, a Tesla car, it doesn't matter. There's metabolites that come off that need to be detoxified and gotten rid of anytime you create energy. So when your body's creating energy, you create these superoxides. These superoxides are extremely damaging. They're just going to damage whatever they come up to next. So your body has defense mechanisms to grab those superoxides and kind of make them inert and then get rid of them through our other systems, whether it's sweat, poop, pee, whatever. That's how it's going to get rid of that. And breathing, I guess, is the other way to detoxify these things. So these mutations look at how well can you take a free radical, a superoxide, and turn it into hydrogen peroxide, which hydrogen peroxide is actually not safe in large quantities either. And so then your body has to turn hydrogen peroxide into water and oxygen, which is very safe. So basically, if you have mutations in either of those spots, then that means you're at higher risk for inflammation. And this is where glutathione really comes in, where we want to increase your glutathione production to encourage those enzymes. There's cofactors, which vitamins always are cofactors. And so the cofactors are going to be manganese and selenium for those two. So if you have mutations in those, we want to make sure we have you on those two micronutrients. I typically don't prescribe a lot of micronutrients individually, like manganese and selenium. Typically, if you're struggling with that, I just say take the multivitamin. That's going to have your manganese and selenium, plus all your other micronutrients that you may or may not need, but your body will wash out if you don't need. So that's the important part about that genetic test. The final part, and I want to see more glutathione genetics in the Pure Genomics report, but right now the only gene that they're looking at is the gene that takes a glutathione molecule and attaches it to toxins. So briefly, I've talked a lot about glutathione, but glutathione is your master antioxidant, your master detoxifier. It is the way your body takes a toxin, sticks a glutathione molecule onto it, and then that basically makes the toxin inert and inactive, and it makes it water soluble so that now you can pee it out and not have any issues. So this gene takes the glutathione molecule, or this enzyme, I should say. This gene codes for an enzyme, and the enzyme catalyzes the reaction where it takes glutathione and attaches it to the toxin. So if you have a mutation in this enzyme, then that means that you can have tons of glutathione, but you're not very good at attaching it to the toxin. And so basically what we would do in that situation is both encourage the cofactors that go along with that enzyme, but also raise the glutathione levels. Since it's already a struggle to attach it, if we just give the body more and more, then it becomes easier and easier to attach it. It's kind of like someone walking down the street with crutches. If you just give them an arm, they can walk so much better, right? And so you can't change anything about that enzyme, but if you can give it some help, then it makes it that much easier. So that's currently the end of the Pure Genomics report right now, but there's going to be so much more over time. They released this, I believe, last year sometime, and it's already made exponential progress. So I would really encourage you to get your 23andme.com kit done. It's super easy. You fill out the form, they send you one, you spit in it, and you mail it back, and you're done. And then two, once you get your data, you can upload it into Pure Genomics. Excuse me, the Pure Genomics actually is a invitation only right now, and so you need to go through a provider that's signed up to actually get access to it, but it is a free deal. So if you've done your 23andMe already and want us to interpret it, then ask for an invite. We'll send you the Pure Genomics, and then we can interpret it for you. So that's about all I have to talk about genetics right now. There's tons out there in regards to genetics. The main thing I want to drive home is that you are not your genetics. Yes, your eyes may be blue or brown or whatever, and you're stuck with those, but you are not stuck with your inflammatory genes and the other cholesterol and blood sugar genes. You are not your family members. So just because there's diabetes in the family doesn't mean you have to struggle with diabetes. There's ways to reverse it. There's ways to change it, and there's ways to enhance the genes that you are stuck with. So make sure you're asking your doctor about genetics, and if they're not familiar with it, if they're not comfortable, if they're not doing the continuing medical education, going to conferences and learning and having a kind of a desire to learn more, and they're not familiar with it, then find someone that is, okay? So I hope this is helpful. Like and share it if you know someone that struggle with methylation or struggle with inflammation and not getting it under control, and test your homocysteine levels. That's an easy blood test to do. Anyone can do it. If you are over 9, you have poor methylation, and you need to get that down. Okay, so that's all for now, guys. Like and share it. I hope everyone's having a good time.